I ask all my guests about it. Why can't we have people like you in politics to make a difference, right? I mean, if you really want to fix Nigeria, it's also from addressing governance. So we need more of you in politics.
We can't all be politicians. We can't all be governors. We can't all be presidents. I think what's important is that we all recognize our purpose, as I mentioned, and find ourselves doing what we want to do the best way, but also supporting the government in driving policy formulation and implementation. I think that's where my strength is. So when I started Mobihealth, I recognized that there were quite a lot of gaps that needed to be filled for digital innovations to really get to the last mile, especially in healthcare. Healthcare has a lot of problems. We needed a multidisciplinary, multi-pronged approach to addressing the multiple challenges that we face, from infrastructure deficit to the lack of funding to the poor remuneration structure for doctors and nurses that is driving them out. So we have push and pull factors that is driving doctors out. It's just beyond asking somebody to be patriotic. It's beyond that. There are push and pull factors that, if they are not addressed, we'll continue to see a massive exodus of doctors. And no matter how many of doctors and nurses that we train, if we don't address those fundamental issues, we will be training them for export.
That every doctor you talk to, 90% of them want a house. And during COVID, just for you to know how furious I was with UK government, I did a petition. I wrote to the Prime Minister, I wrote to the embassy, furious about the fact that nobody was talking about it. UK had a policy to attract Nigerian doctors. You know, I mean, it's a case of David going after the only wife of one of his disciples, simply because he just needed another wife, when he has God knows how many tens of wives about that time. Like UK with a whole number of doctors, trying to get doctors from Nigeria. I was so mad about it. But using you as an example, any doctor that is going out of Nigeria for whatever reason will still come back.
Well, I used to get a lot of calls from back home in Nigeria asking for second opinion, asking for you to vet some certain kind of treatment. And I was doing that over the phone. I'll connect patients in Nigeria to doctors in London, in the US. So I started to research and find, what could I do differently? How can I scale this solution? So I didn't want to do public health. I wanted something a bit more versatile. So I researched and I found that Cambridge University did something that was called Bioscience Enterprise. And it had to do with bringing scientific innovation, biotechnology, scientific innovation to scale. So I did my master's in Bioscience Enterprise from Cambridge University, and that kind of springboarded me into the journey of Mobihealth. So for me, Mobihealth is a very personal journey. I would say it's my passion really blending with my purpose in life.